Hello and welcome to Seniors Together, a place where we share simple tips for living healthier, happier, and more meaningful lives in our golden years. Here, we learn, grow, and stay inspired together, because life is always brighter when we share the journey. You know, sometimes the biggest threats to our health don't come from serious diseases. They actually come from the tiny pills we take every single day. Let me tell you about Mary, a 72-year-old woman from Ohio. Mary was the sweetest lady, always cheerful, walking her dog every morning, and spending her evenings playing cards with her neighbors. But just in the last few years, her life began to change. To help herself sleep better, Mary got into the habit of taking one little allergy pill, Benadryl, every night. At first, nothing seemed unusual, but soon her family noticed something wasn't right. She started repeating the same questions over and over. She forgot the recipes she had cooked by heart for decades. One evening she drove to the grocery store just a few blocks away but couldn't find her way back home. Her family was terrified. Could this really be the early signs of dementia? When Mary came to see me, we discovered something shocking, and honestly a bit frightening. The very pill she trusted, the one she thought was harmless, may have been silently chipping away at her memory for years. And that's exactly why I'm talking to you today. Because there are some very common medications, drugs many of us or our loved ones take every day, that can speed up memory loss and even raise the risk of dementia. You and your family need to know this truth, so you can protect your brain, your memories, and your life. Mary's story is not rare. In over 30 years of practicing medicine, I've seen countless patients come in with confusion, memory problems, and families fearing the worst, that their loved one had Alzheimer's or another form of dementia. But after careful review, we found that the real culprit was often the very medications they were taking faithfully every day. And this isn't just my personal experience. Large scientific studies have confirmed it. For example, a well-known 2015 study published in JAMA Internal Medicine followed over 3,000 older adults for more than 7 years. It found that those who took anticholinergic drugs long-term, medications that block the neurotransmitter acetylcholine, had a 54% higher risk of developing dementia. Acetylcholine is crucial for memory and learning. So when it's disrupted, the brain suffers. Another study out of Germany in 2016 analyzed data from more than 73,000 patients and found a clear link between using sleep medications like benzodiazepines and a higher risk of Alzheimer's disease. In fact, the risk rose significantly even after just a few months of regular use. And researchers at Harvard have also raised alarms about allergy medications like Benadryl, the same one Mary relied on, warning that long-term use may directly contribute to cognitive decline. All of this evidence points to one important fact: medication is not always a completely safe solution, especially when it's taken long-term. So the big questions are, which common medications are most likely to speed up memory loss? And more importantly, what can we do to protect our brains so we can stay sharp and healthy as we age? In today's video, I'm going to walk you through 9 common drug groups that science has proven to be linked with memory decline, and I'll share safer alternatives you can discuss with your doctor. The very first group of medications I want to talk about is antihistamines. These are drugs that most Americans are very familiar with. They're often available over the counter, things like Benadryl, chlorotrimton, or some of those combination cold and flu medicines. People usually take them to ease allergies, relieve nasal congestion, stop sneezing, and some even use them to help fall asleep. On the surface, they may seem harmless, but the truth is, they carry hidden risks. You see, many of these drugs have what's called anticholinergic effects, meaning they block the action of acetylcholine, a vital neurotransmitter that helps your brain process memory and focus. When acetylcholine is suppressed for too long, memory starts to decline and the brain actually ages faster. I remember meeting David, a 68-year-old man from Texas. He was generally healthy, only dealing with a bit of seasonal allergies. Because he had trouble sleeping, he got into the habit of taking a Benadryl pill every night. At first, it worked, he fell asleep faster. But within just a few months, he began forgetting things. He missed appointments with friends, couldn't remember where he parked his car, and even misplaced his keys constantly. His family grew worried, thinking it might be early Alzheimer's. When I examined him, it became clear. The real culprit was his nightly Benadryl habit. Once he stopped taking it and switched to safer alternatives, his memory noticeably improved. David's story is not an isolated case. In fact, a 2015 study from the University of Washington, published in JAMA Internal Medicine, tracked over 3,000 older adults for 7 years. Researchers found that people who took high doses of anticholinergic medications, especially antihistamines, for extended periods had a 54% higher risk of developing dementia compared to those who didn't. The risk is real, and the longer you use them, the greater the danger. What's even more concerning is that many people still treat Benadryl as if it's a safe sleep aid, just because it's sold in every pharmacy without a prescription. But here's the reality: after age 60, the brain doesn't bounce back the way it used to. Every pill you take may feel harmless, but if you're using it night after night, it's like tiny drops of water slowly eroding your memory. One day, you wake up and realize your mind isn't as sharp as it once was. So if you're struggling with allergies or insomnia, what should you do instead? We'll talk about safer alternatives later on, after we go through the other medications on this list. But for now, remember this. First-generation antihistamines like Benadryl are drugs you should treat with extreme caution, especially if you're thinking about long-term use. The second type of medication I want to warn you about is the benzodiazepine family, often shortened to benzos. These include familiar names like Valium, Xanax, Ativan, and Klonopin. They're commonly prescribed to treat anxiety, insomnia, stress, or seizures. When you take one of these pills, it acts directly on your central nervous system, helping the body relax and making it easier to fall asleep. It sounds harmless enough, but what many people don't realize is that when used regularly and for long periods of time, these drugs can actually slow down the brain, weaken memory, and increase the risk of dementia. I vividly remember the case of Susan, a 65-year-old woman living in Florida. She had been a devoted elementary school teacher and a loving mother. After her husband passed away, she developed severe anxiety and long-term insomnia. Her doctor prescribed Xanax, and at first, it seemed like a godsend. She was finally able to sleep, and her mood improved. But just 1 year later, her family began to notice changes. Susan became increasingly forgetful, confused her former students' names, and even once went to the grocery store for milk only to forget why she was there. When she came to see me, we reviewed her medications, and it became clear that her long-term use of Xanax had played a major role in accelerating her memory decline. Susan's story isn't unique. Research has consistently shown a link between benzodiazepines and dementia. One large Canadian study, published in the British Medical Journal in 2014, analyzed data from more than 1,700 Alzheimer's patients and nearly 7,000 control subjects. The results were striking. Long-term benzodiazepine use increased the risk of developing Alzheimer's disease by up to 51%, and the longer the use, the higher the risk. Another German study, involving more than 73,000 patients, confirmed this strong association. The troubling part is that many people treat benzodiazepines like a lifeline for their sleep or anxiety, without realizing that the brain is paying a very steep price. For older adults, side effects such as confusion, dizziness, falls, and memory loss can be even more dangerous than the insomnia these drugs were meant to treat. So if you or a loved one are currently taking these medications, please be cautious. This doesn't mean you should stop immediately. Quitting abruptly can be dangerous, but it does mean you should talk with your doctor about a plan to taper down safely, or explore safer alternatives for managing anxiety and improving sleep. You only get one brain. Protecting it is a mission that should never be delayed. My dear friends, perhaps all of us have gone through those long, restless nights, tossing and turning, unable to fall asleep no matter how hard we try. And in those desperate moments, the most tempting solution often seems to be modern sleeping pills. Familiar names like Zolpidem, Ambien, or S-zopiclone, Lunesta, are often mentioned as a lifesaver. Since they aren't classified as benzodiazepines, many people assume they're safer. But the truth is far more complicated. A large-scale study published in the BMJ revealed that people who regularly take sleep medications like Ambien face a significantly higher risk of death. And their risk of dementia increases with the dose. Scientists explain that although these drugs have a different chemical structure, they act on the same receptors in the brain as benzodiazepines, suppressing the central nervous system. As a result, users often experience confusion, memory decline, and even falls, an especially serious danger for older adults. I'll never forget the case of Mr. Richard, a 68-year-old from Texas. He suffered from chronic insomnia, and his doctor prescribed Ambien. At first, the results seemed miraculous. One pill and he could sleep. But within just a few months, his family grew concerned. He became forgetful, repeated the same stories, and even once wandered out of the house in the middle of the night with no memory of it the next morning. This is exactly the kind of sleep medication-related behavioral disorder that medical literature has documented many times. In fact, the FDA has issued clear warnings that these sleep aids can trigger bizarre, unconscious behaviors, driving, eating, even making phone calls, only for the patient to wake up with no recollection whatsoever. For older adults, who already face a higher risk of cognitive decline, adding another drug that suppresses brain activity is like pouring fuel on the fire. Of course, not everyone who takes these medications will immediately experience such side effects. But over the long term, the risks often outweigh the benefits. Multiple studies have shown that instead of relying on sleeping pills, we should prioritize safer, more sustainable solutions. CBTI, cognitive behavioral therapy for insomnia, has been proven highly effective. In fact, several studies in the U.S. found that up to 70% of patients achieved significant improvements in sleep, and the results lasted for years without side effects. What I want to leave you with is this: if you or a loved one are currently using Ambien, Lunesta, or similar medications, be very cautious. Don't hesitate to talk with your doctor about gradually tapering down the dose or switching to safer approaches. Sleep is priceless, but wakefulness, memory, and your quality of life during the day are even more valuable. Now, let's move on to a group of medications that may seem harmless, but actually carry serious risks for older adults: first-generation antihistamines. Familiar names like diphenhydramine, better known as Benadryl, chlorpheniramine, and hydroxyzine have been staples in American households for decades. They're often used to relieve allergy or cold symptoms, and many people even misuse them as a kind of mild sleeping pill. But what most people don't realize is that these drugs are strong anticholinergics. In other words, beyond blocking histamine to reduce itching, sneezing, and runny nose, they also interfere deeply with the central nervous system. In younger adults, this might just cause mild side effects like dry mouth, drowsiness, or slowed reflexes, but in older adults, the consequences can be far more severe: confusion, temporary memory loss, increased fall risk, and even a higher chance of developing dementia. One large study published in JAMA Internal Medicine in 2015 followed more than 3,500 older adults for over 7 years. The findings were alarming. People who regularly used first-generation antihistamines had a 54% higher risk of developing dementia compared to those who didn't. Doctors have reported many cases where patients were admitted to the hospital with severe confusion. Families feared it was the onset of Alzheimer's, only to later discover that the real culprit was long-term use of classic antihistamines. I vividly remember the story of Mr. James, a 75-year-old from Texas. He had seasonal allergies and often bought Benadryl to take at night, thinking it would also help him sleep. At first, everything seemed fine, but after a few months, he became forgetful, sometimes leaving home and not remembering where he was going. His daughter was terrified, convinced her father was developing dementia. But when they went to see the doctor, it became clear: Benadryl was the cause. Once he stopped the medication and switched to a safer alternative, his confusion improved noticeably. It was a powerful reminder that even harmless medications can disrupt not just a patient's health, but the peace of mind of an entire family. So why are first-generation antihistamines so risky? The key reason is that they cross the blood-brain barrier and block acetylcholine receptors, neurotransmitters that play a critical role in memory and alertness. When these are suppressed, the brain easily slips into a foggy, confused state with slowed reaction times. This is exactly why the American Geriatrics Society has included these drugs in the Beers criteria. A list of medications that older adults should avoid whenever possible. It's also important to point out that not all antihistamines are equally dangerous. The newer generation, such as loratadine, Claritin, cetirizine, Zyrtec, and fexofenadine, Allegra, are much less sedating and far less likely to affect the brain, making them a much safer choice for seniors. If you struggle with seasonal allergies or nasal congestion, talk to your doctor about switching to these alternatives instead of relying on Benadryl. The takeaway here is simple. Never underestimate familiar medications. That one Benadryl pill you take to fall asleep may feel safe in the moment, but over time it can quietly steal your memory and mental sharpness. Clear thinking is one of the greatest treasures of old age, and protecting your brain starts with making smarter choices about the medications you use, starting today. One of the drug classes I often have to explain to my older patients is tricyclic antidepressants, TCAs. Familiar names include amitriptyline, nortriptyline, and imipramine. These medications were first introduced back in the 1950s and were once considered a revolution in the treatment of depression. Beyond depression, doctors sometimes prescribe TCAs for insomnia, chronic pain, or nerve pain. But here's the challenge: in older adults, TCAs carry significant risks. The main reason lies in their strong anticholinergic effects, very similar to the older antihistamines I mentioned earlier. This can lead to confusion, memory problems, dry mouth, constipation, urinary retention, low blood pressure when standing, and, most importantly, a much higher risk of falls. In fact, a study published in the Journal of the American Geriatrics Society found that older adults taking TCAs were 2.2 times more likely to experience a fall compared to those who didn't take them. Let me share a real story. Mr. Robert, a 68-year-old retired carpenter, came to see me for nerve pain caused by diabetes. He was started on a low dose of amitriptyline to help with pain and sleep. At first, things seemed fine. He slept more deeply and felt some relief. But within weeks, he began to notice dry mouth, dizziness when standing up, and trouble with his memory. Then one morning, he slipped in the bathroom, fractured his hip, and had to be hospitalized. Sadly, cases like Robert's are not rare, and they show just how risky TCAs can be for older adults. Science backs this up. A meta-analysis of more than 25 studies confirmed that TCAs not only increase the risk of falls, but can also impair long-term cognition, and may even accelerate the progression of dementia. What's more concerning is that many of these side effects are often mistaken for normal aging, leaving patients and families unaware of the real danger. Here's what we need to keep in mind. Not every case of depression or chronic pain requires a TCA. Today, we have much safer options, like newer antidepressants, SNRIs, or non-drug approaches such as psychotherapy, physical therapy, or relaxation techniques. With the right choice, patients can feel better without putting their safety and independence at risk. And one last but very important note: if you or your loved one is currently taking a TCA like amitriptyline or imipramine, do not stop suddenly on your own. Instead, talk with your doctor about safer alternatives and a proper plan. Mental health is precious, but it should never come at the cost of safety and quality of life. Now, let's talk about another class of medications that many older adults may find in their prescriptions: antipsychotics. These drugs were originally developed to treat serious psychiatric conditions such as schizophrenia or delusional disorders. But in reality, quite a number of seniors are prescribed them to manage agitation, difficult behaviors, or severe insomnia related to dementia. At first glance, this might sound reasonable, but the short-term benefits often come at a very high cost. A study published in the New England Journal of Medicine found that in older patients with dementia, the use of antipsychotics increased the risk of death by 1.6 to 1.7 times compared with those who did not take them. That is no small number. Common side effects include excessive drowsiness, confusion, dizziness, orthostatic hypotension, a sudden drop in blood pressure when standing, movement disorders like tremors or muscle stiffness, and perhaps most concerning of all, a much higher risk of falls and fractures. And as you know, a single fall can completely change an older adult's life. I'm reminded of Mr. George, a 78-year-old patient. He was prescribed an antipsychotic to calm his nighttime yelling caused by dementia. At first, his family felt some relief. He was quieter. He slept more, but just a few weeks later, George became overly drowsy, unsteady on his feet, and eventually suffered a fall in the bathroom that fractured his hip. From then on, his mobility and quality of life declined drastically. That's why the American Geriatrics Society, AGS, advises that antipsychotics should only be used in older adults when absolutely no other option exists, and only when symptoms are severe and dangerous. Even then, the dose should be as low as possible, the duration as short as possible, and the patient closely monitored. More importantly, before turning to medication, we should always prioritize non-drug approaches, creating a calm environment, establishing a structured daily routine, reducing overstimulation, and using relaxation or psychological support strategies. They may not work as quickly as a pill, but they are safer, more sustainable, and they help our loved ones stay clear-minded. In short, antipsychotics are not a safe long-term solution for most older adults. Mr. George's story is a powerful reminder. Sometimes, the price we pay for a little short-term quiet may be our health, independence, and even life itself. Let's take a look at the story of Richard, a 75-year-old living in Texas. He had been dealing with high blood pressure for many years, and his doctor prescribed doxazosin, an alpha blocker, to help keep it under control. At first, everything seemed fine, but just a few weeks later, he began feeling dizzy whenever he stood up. Then one morning, he collapsed right in his living room and had to be hospitalized with a hip fracture. When his doctors reviewed his medications, they realized the main culprit was doxazosin, because this drug can cause orthostatic hypotension, a sudden drop in blood pressure when changing positions. Richard's story is far from unique. In older adults, many blood pressure medications, especially alpha blockers, such as doxazosin, prazosin, or terazosin, and certain beta blockers, often trigger dizziness, fatigue, or even fainting. Since the body's ability to regulate blood pressure slows with age, the risk of falling increases dramatically, and falls are one of the leading causes of disability and even death among seniors. A study published in JAMA Internal Medicine, 2014, found that older adults taking blood pressure medication had a 30 to 40% higher risk of serious falls, especially if they had already fallen before. What's even more concerning is that among patients over 70 who suffer a hip fracture, only about half recover fully within a year. On top of that, some blood pressure drugs can affect the central nervous system, impairing memory and focus. According to the Hypertension Journal, 2018, seniors taking these medications face a higher risk of cognitive decline compared to those who don't. Now, this doesn't mean older adults should stop taking blood pressure medicine. Quite the opposite. High blood pressure is known as the silent killer because it can lead to strokes and heart attacks. The key is choosing the right medication at the right dose with ongoing medical supervision. Today, many experts recommend low-dose thiazide diuretics or ACE inhibitors as safer alternatives to alpha blockers, since they carry a lower risk of falls and memory problems. The takeaway is this: if you or a loved one are taking blood pressure medication, pay close attention to warning signs such as dizziness, lightheadedness when standing, or unexplained falls, and never stop your medication on your own. Always talk with your doctor about safer, more suitable options. When people hear about anti-epileptic drugs, they often assume they're only prescribed for patients with epilepsy. But in reality, over the years, doctors have also used these medications to treat conditions like nerve pain, bipolar disorder, and even to help with sleep. Familiar names such as phenytoin, carbamazepine, valproate, and gabapentin all fall into this category. However, for older adults, especially those already experiencing memory decline or balance issues, these medications can be a double-edged sword. Research has consistently shown that anti-epileptic drugs can double the risk of falls and injuries in seniors compared to those who don't take them. For example, an analysis published in the Journal of the American Geriatrics Society found that patients over the age of 65 who regularly used gabapentin had a 1.6 times higher risk of falling. The reason is simple. These drugs slow down nerve transmission, which makes brain reflexes sluggish, coordination weaker, and everyday accidents, like tripping in the living room, far more likely. I think of one patient, Mr. Johnson, a 74-year-old from Texas. He was prescribed carbamazepine to manage chronic nerve pain after surgery. At first, the medication gave him much-needed relief. But within months, he began experiencing dizziness whenever he stood up too quickly. One day, he fell in the bathroom and ended up in the hospital with a hip injury. That incident pushed his family and his doctor to re-evaluate his treatment plan, adjusting the dose, adding physical therapy, and encouraging lifestyle changes, instead of relying solely on medication. Stories like this highlight an important truth. While anti-epileptic drugs can provide real benefits when used correctly, they also carry significant risks for older adults if not carefully monitored. That's why doctors usually recommend starting with the lowest effective dose, while keeping a close eye on warning signs such as drowsiness, balance problems, or changes in memory. Family members also play a crucial role by noticing these changes early and communicating them to the healthcare team. So, rather than avoiding anti-epileptic drugs altogether, the key is to understand both the benefits and the risks, and to work closely with medical professionals to find the safest, most effective treatment for each individual. And just like with so many other medications we've discussed, it's a powerful reminder. The aging body is far more sensitive, which means every prescription requires caution, careful monitoring, and never, ever, self-adjusting the dose without medical guidance. Now, let's move on to the last group of medications on our list, corticosteroids. These drugs are commonly prescribed for patients with arthritis, asthma, severe allergies, or autoimmune diseases. Corticosteroids are well known for their ability to control inflammation quickly and powerfully. But along with that benefit comes a significant downside: their impact on memory and brain function. Many patients in the U.S. have shared that when they start taking corticosteroids like prednisone, they experience restlessness, persistent insomnia, and at times, even confusion and difficulty focusing. A study published in the Journal of Clinical Psychiatry found that long-term corticosteroid use increases the risk of short-term memory loss and mood disturbances. Scientists explain that these drugs may directly affect the hippocampus, the area of the brain responsible for storing memories and supporting learning. I'll never forget the case of Robert, a 68-year-old with rheumatoid arthritis. He was prescribed prednisone to keep inflammation under control, but just a few weeks later, he began forgetting tasks he had just done, frequently misplaced items, and struggled with relentless insomnia. At his follow-up, the doctor had to adjust his dosage and gradually transition him to biologic medications that are less likely to interfere with brain function. This story reminds us that corticosteroids can be extremely valuable in acute situations. But long-term use must be closely monitored, especially in older adults. The guiding principle is always to use the lowest effective dose for the shortest possible duration, while supporting the body with lifestyle measures such as gentle exercise, a diet rich in leafy greens, and omega-3 supplementation to reduce negative effects on the brain. So if you or a loved one are taking corticosteroids and notice memory problems, trouble sleeping, or mood changes, talk to your doctor right away. Never stop these medications on your own. But also don't ignore the warning signals your body is sending you. Only with awareness and collaboration with your healthcare team can you truly safeguard both your physical health and your mental well-being. So, we've now walked through 9 common groups of medications that can negatively impact memory and brain health. from sleeping pills, tranquilizers, and older antihistamines, to tricyclic antidepressants, antipsychotics, blood pressure medications, anticonvulsants, and finally, corticosteroids. Each of these medications plays an important role in treating illness. Yet at the same time, each carries side effects that too often go unnoticed. The most important message I want to leave with you is this: always stay aware and proactive when it comes to your own health. If you or a loved one begin to notice memory decline, mood changes, or sleep disturbances while taking a prescription, don't rush to blame it on aging. Instead, have an open and honest conversation with your doctor. Sometimes, the solution is as simple as adjusting the dosage, switching to a safer alternative, or adding natural lifestyle measures to support your brain. Remember, your brain health isn't just about medical charts, it's the key to your independence, joy, and lasting connections with family and friends. And if this video brought you value, don't forget to hit like, share it with someone you care about, and subscribe to the channel. Together, we can keep learning, growing, and protecting our memory for the years ahead.